Most of us have had a migraine at some point in our lives. They can be extremely painful, disturb your vision, and be absolutely debilitating. But what about when it's not you who's affected but your child? And what if it's not an isolated incident, but a recurrent, persistent problem that begins to affect every aspect of their life? Allow me to tell you that your greatest weapon, your greatest power is in your knowledge. The more you know about what your child is suffering from, the more you understand, the more empowered you'll feel to help your child regain their life. An estimated 5% of all children suffer from migraine. Presentation of migraine in children is often very similar to that of adults. The symptoms can vary greatly and can include extreme pain, nausea, vomiting, light sensitivity, aura, dizziness, vertigo, syncope, tunnel vision, blind spots in their vision, complete blindness, numbness or tingling in their limbs, difficulty with their speech, and an absolutely endless list of others. If you believe that your child may be suffering from migraines, the first step is to get an accurate diagnosis. You should take your child to their pediatrician. Their pediatrician will assess their symptoms, and if they believe that your child is suffering from migraines, they are probably going to refer you to a neurologist who is probably going to do certain tests, such as an MRI or a CAT scan. These tests can not only diagnose migraine, but can also rule out other possible causes. Once you have a diagnosis, you should realize that no matter how helpless you may feel, you can be your child's greatest asset in their battle to regain their life and the freedom to enjoy their childhood. Education concerning migraines is critical to the care and prevention of them. You can learn not only to help your child manage an attack, but to prevent one in the first place. It can be a tremendous help in discovering triggers or indicators to keep a journal that includes not only when your child has each migraine, but the symptoms, the length of the migraine, their activities preceding the migraine, what medications they're taking, what they've eaten each day, any emotional upsets, changes in their daily habits, and absolutely anything that you feel may be pertinent. This can go a long way in helping to determine things such as triggers, patterns, and which treatments are most effective for your child. Treatments typically, at least initially, include medication that may be strictly for the relief of pain, or it can be to abort the symptoms, or to prevent the occurrence of the migraines in the first place. It may also include other things that will allow you to be more proactive in your child's treatment. These things may include things like stress management, and recently studies have shown that yoga is extremely effective in this. Biofeedback, hypnosis, avoidance of common dietary and environmental triggers. Avoiding triggers can help to minimize or even eliminate migraines in many children who suffer. Some of the more common triggers for migraines are stress, intense emotion, bright light, changes in sleeping habits, illnesses, dehydration, missing meals, processed meats, aged cheeses, cultured dairy products, artificial sweeteners, and any hormonal changes that your child may be going through. But remember, almost anything can be a trigger, and each child has their own. The important thing is to learn what your child's triggers are so that you can learn to avoid them. Although seeing your child suffer is one of the absolute worst things a parent will ever have to endure, remember, you are not helpless. Be proactive. Find the treatment that works best for your child. Learn to avoid the triggers. Realize that there are constant advances in treatment, and recognize that this is not your child's life, but merely a bump in the road to it.